In our clinical practice, we often see postmenopausal women and elderly people coming to the hospital with history of fractures, either the fracture of hip, vertebral fractures, or fracture of the wrist. And this happens usually due to a simple slip or fall at home. This is what we call as fragility fractures. Fragility fractures occur due to a condition called as osteoporosis. What is osteoporosis? Osteoporosis is a condition where the bone mass is reduced and there are changes that happen in the bone structure which lead to increased fragility and susceptibility to fracture. There are two types of osteoporosis: primary osteoporosis and secondary osteoporosis. Primary osteoporosis occurs in women after menopause. In postmenopausal women, lack of estrogen leads to loss of protective effect on the bone, and in elderly people, which is called as senile osteoporosis, there is loss of bone mass due to aging process. In secondary osteoporosis, the bone mass is reduced secondary to a disease or any other condition. Secondary osteoporosis usually occurs in certain conditions like rheumatoid arthritis, chronic conditions like chronic liver disease, chronic kidney disease, malignancy, malabsorption syndromes, certain drugs which if we are using for a long time, like steroids, for any reason if we are on steroids for more than 3 months, it can lead to loss of bone mass. And certain acid suppressing drugs like proton pump inhibitors and drugs which are anticonvulsants can also cause loss of bone mass. Other lifestyle changes like excessive alcohol consumption and excessive smoking can also lead to bone mass loss. Conditions like vitamin D deficiency and osteomalacia are also associated with osteoporosis. So it is important that if there is a patient who comes with osteoporosis, we have to determine whether it is primary osteoporosis, which is related to either postmenopausal osteoporosis or age-related osteoporosis, or if there is a disease or a condition which is actually causing this bone loss. What are the symptoms of osteoporosis? Many of the patients with osteoporosis complain of no symptoms at all. Some of the patients can have back pain, and this back pain is because of tiny fractures in their vertebra in the spine. And multiple such tiny vertebral fractures can lead to loss of height over a period of time. Some of these patients may also develop a stoop posture. One of the very important complications of osteoporosis is development of fragility fractures. Patients with osteoporosis can have a minor fall or a slip and can develop fractures involving the hip, spine, or the wrist region and can present to the hospital. What are the tests advised for osteoporosis? One of the most common tests that is advised for osteoporosis is called as bone densitometry test or DEXA scan. This test determines the bone mass of these patients, and it is determined by a parameter called T-score. If the T-score in bone densitometry test or DEXA scan is less than -2.5, it means that the patient is having osteoporosis. Anything between -1 to -2.5 is osteopenia or borderline case, and anything above -1 is normal. Apart from that, there are other tests which are advised by the doctor to rule out possibility of secondary osteoporosis. These tests are serum calcium levels, serum phosphorus, serum albumin, vitamin D levels, PTH levels, and serum creatinine, and a few other tests if deemed necessary by the doctor. Based on these test reports, you can determine whether there is osteoporosis or not, or if there is a possibility of any secondary cause of osteoporosis. How do we manage patients with osteoporosis? There are certain lifestyle measures which we advise people to prevent and manage osteoporosis. These lifestyle measures are: 1. To ensure adequate dietary calcium intake. So the daily calcium intake to prevent osteoporosis should be around 1200 milligrams per day. So this can be obtained either through the diet or you have to give oral calcium supplementation. Number 2 is to ensure adequate vitamin D levels. If the patient is deficient in vitamin D, first we should correct the vitamin D deficiency. And then the daily maintenance dose of vitamin D is usually 400 to 800 international units per day. Number 3 is to Ask patients who are smoking to quit smoking because smoking can accelerate the bone loss. Number 4 is exercise. Regular exercise is very important. Moderate intensity aerobic exercise 30 minutes a day, 5 days in a week is advised. And for at least 2 days in a week, you can also advise them weight based or strength or resistance exercises to improve the bone mass. Apart from that, in people who consume alcohol, we have to advise them to restrict the amount of alcohol intake for not more than 3 drinks per day. These are some of the lifestyle measures which we can advise patients to prevent and manage osteoporosis. What are the drugs that are used to manage osteoporosis? There are two types of drugs that are advised in patients with osteoporosis. The drugs which reduce the bone loss, which are called as anti-resorptive drugs, and the drugs which help to form the bone, which are called as anabolic drugs. Among anti-resorptive drugs, we have drugs called bisphosphonates, which are the most commonly prescribed drugs for osteoporosis. They are available in oral form and also in IV preparation. They can be given daily, once in a week, once in a month, and IV preparations are available which can be given as once in a year. Apart from bisphosphonates, the other drug is denosumab as an alternative. It is an injectable form that can be given twice in a year. Then there are anabolic drugs which help to form the bone. Among them, we have teriparatide. It is an injectable form given once daily for a period of 2 years. So these are some of the drugs which can be prescribed by your doctor for managing your osteoporosis. If you are a postmenopausal lady or anyone who is above 50 years of age, it's time that you talk with your doctor about your bone health. Be aware and be healthy.